My target group for this presentation are nurses that currently work on my staff. Lennox-Gastaut syndrome, or LGS, is a rare severe form of epileptic encephalopathy. The typical onset occurs before 8 years of age, with peak occurrence between the ages of 3 and 5. LGS is characterized by a triad of symptoms, which include multiple seizure types, slow spike and wave EEG, and a level of neurological impairment that will vary with each child. LGS is considered a catastrophic epilepsy due to the resistance of seizures to anticonvulsant medications and the likelihood of injury due to falls from some of the types of seizures that are associated with this disorder, and the intellectual impairment that a majority of children suffer with LGS. It is highly resistant to treatment with anti-epileptic medications, and there is no known cure for LGS. LGS may be caused by perinatal hypoxia, congenital infections, stroke or trauma, tuberous sclerosis, which is a rare genetic disorder, cortical dysplasia, or other unknown causes. 30 to 35% of LGS cases have no known cause. A child that has LGS will have multiple types of seizures. The most common seizures are associated with LGS are axial tonic seizures, atypical seizures, atonic seizures or drop attacks, and non-convulsive status epilepticus. The axial tonic seizure is the most common seizure that is found in LGS, and it actually must be present in order for a diagnosis of LGS to be made. This type of seizure involves a brief uniform pattern of movement with moderate flexion of the hips, upper trunk, and the head and the arms will usually elevate into a semi-flexed position. The atypical seizures are the second most common in LGS, and this type of seizure involves a period of staring. Looks like they're staring off into space. It is a gradual onset, and the child may actually still continue to interact to some extent while they're having this type of seizure. The other seizure is atonic seizure or a drop attack, and this involves a sudden loss of muscle tone, and this is where they may lead to injuries due to falls with this type of seizure. Non-convulsive status epilepticus is a prolonged seizure without any involuntary jerking or stiffening of the muscles, and there may be a change in mental status present. LGS does not affect the body systems like other diseases such as diabetes or chronic kidney disease. There are actually no direct effects on the reproductive, endocrine, hematologic, or cardiovascular systems in a child that has LGS. If there are any problems with any of these body systems, it is typically related to another diagnosis. The respiratory, GI, and GU systems do have some indirect effects from LGS. The musculoskeletal system is indirectly affected by LGS. Children with LGS may suffer from injuries due to falls while they're having an atonic seizure, and they may have other physical injuries due to tonic seizures and the other seizures that are common in LGS. There is a vitamin D deficiency that is common in children with any form of epilepsy. There is no actual research showing the actual cause of the vitamin D deficiency. There is minimal research regarding anti-epileptic drugs and an increased risk for fractures, which would be due to the vitamin D deficiency. There is research showing that children treated with anti-epileptic drugs tend to have problems with bone metabolism and decreased bone density, which would lead to more fractures. The respiratory function is not directly affected in children with LGS. However, most patients with LGS will have neurological impairments, such as cerebral palsy, and this may lead to respiratory issues. Children may have an inadequate airway clearance due to an impaired cough, which can lead to more respiratory infections. And also, depending on the severity of the neurological impairment, children may require a gastrostomy tube, which will put them at an increased risk for aspiration pneumonia. The gastrointestinal and genitourinary systems are also not directly impacted by LGS. Most of these problems are more associated with the neurological impairment that typically comes with LGS. This neurological impairment may cause an inability to express hunger, difficulty swallowing any food or even medication, and also inadequate nutrition or hydration. Both of those could lead to the need for enteral feeding and the gastrostomy tube. They also may experience urinary and bowel incontinence due to their neurological impairment. The modifiable factors associated with LGS are medication and diet. Children with LGS have a complex medication regimen due to the use of more than one type of anti-epileptic medication. This may cause noncompliance with the medications due to the many different medications that the parent will have to administer to their child. There may also be noncompliance due to ineffectiveness and side effects of the AEDs. It is very important that, due to these reasons, parents not only understand the reason for administering the medication, but the implications if they do not administer the medication. They must also have knowledge of the adverse effects and side effects associated with the medications and understand the disease process and how the AEDs are going to affect the seizures. The caregivers or parents need to understand that even if they have 3 or 4 medications that they're giving to their child, that this is not going to stop the seizure activity and that they're not going to be able to cure the seizures that these children suffer from. Diet. There is a ketogenic diet that can be used to treat seizures, not just in LGS, but in other forms of epilepsy. It is very restrictive, as it is basically a Atkins diet. Some of the side effects can be rather serious, including cardiomyopathy is an adverse reaction to long-term use of the ketogenic diet. And there's also many labs that need to be monitored at least every 3 months during the first year of the ketogenic diet. And this could lead to noncompliance. LGS is not a congenital disease. It is not related to a gender, a race, or ethnicity more than any other. Any child could be afflicted with LGS. There is some research showing that a child that has normal growth and development and does not have any seizures or any underlying problems, and they develop seizures and then in turn develop LGS. There is no gene or mutation that is specific that causes LGS. The cause of tuberous sclerosis, one of the possible causes of LGS, is a genetic mutation, but that is not, there is no actual data showing how many children actually have LGS due to tuberous sclerosis. So in this case, there are really no non-modifiable factors that we are going to deal with. The nursing interventions associated with Lennox-Gastaut syndrome are mostly going to be education for the family, the parents, the caregivers. The seizures that are associated and are common in LGS do not typically require any emergency management. They will not typically go to the emergency room due to the seizures that are associated with LGS. The nurse may be required to administer a rectal diazepam for a sustained seizure. Sometimes, depending on the physician's order, the seizures It may be a sustained seizure longer than 5 minutes or even one lasting longer than 1 minute. This is not a typical drug that is used when treating children with LGS. The nurse will need to monitor the labs that will be associated with children that are on a ketogenic diet. They will also, of course, need to monitor any side effects of the AEDs that the child may suffer from and make sure they're educating the family on those side effects and the things to look for those medications. They will also need to educate the family on the disease process itself and the safety measures that need to be implemented in the home, particularly seizure precautions. The seizures that are associated with LGS are not ones that the child is going to require oxygen or they're going to stop breathing. These are not typical problems in the seizures that occur with LGS. They will need to have some padding on the bed rails, helmet possibly for head protection, or I had a child that had the floors in the home were actually padded with like the mats from a gymnastics, and all of the places where the child went had that type of flooring, and along the walls in the same rooms they also had that padding. But those would be the biggest measures. So the nursing interventions are going to have a lot to do with educating the family and the parents. The treatment for LGS involves anti-epileptic drugs or AEDs, a ketogenic diet, vagal nerve stimulation, and cannabidiol or CBD. There are numerous AED drugs in the treatment of epilepsy and Lennox-Gastaut syndrome. I will just speak about the four that are most commonly used in LGS. The first line AED for treating LGS and other epilepsies is typically valproic acid, which is kind of interesting since there have been no randomized controlled trials on the effectiveness of valproic acid in treating seizures. If the valproic acid is ineffective in treating LGS, one other drug may be added as adjunct therapy or to replace the valproic acid. The Felbutol can be used either as a monotherapy in LGS if the valproic acid is not effective, or it can be used as adjunct therapy. Banzel is also another drug that can be used as adjunctive therapy, and it is effective in treating drop attacks. There was a study that showed 42.5% reduction in seizure frequency and improvement of the severity of seizures when treated with Banzel. Another AED is Onfi, and that is a benzodiazepine that can be used also as an adjunctive therapy, but it can only be used in children 2 years of age and older. This one is also effective in treating drop attacks and also has a randomized controlled trial that showed improvement in the number of drop seizures in children. The ketogenic diet is a high-fat, low-carbohydrate, moderate to high-protein diet that is similar to the Atkins diet. The exact mechanism of action on seizures is unknown. The brain does utilize the ketones as energy rather than the glucose. The diet actually causes the metabolism to respond as if the body were starving, and it will utilize the fat stores rather than glucose from carbohydrates, since there are very low carbohydrates in the ketogenic diet, and it will use the ketones as an energy source. Children must be maintained in a ketotic state in order for this diet to be effective, which can be difficult. And this is where sometimes parents are not 100% compliant, but it is very important for them to understand that the children must stay in a ketosis or it will not have any effectiveness on the seizures. Children will need to be tested, have their urine tested twice a day by parents or caregivers. They will need to use dipsticks in order to check the ketones and make sure that they maintain that ketotic state. There are, of course, with the long-term use of the ketogenic diet, there are, of course, adverse effects. Some of them may be decreased bone density, nephrolithiasis, and cardiomyopathy, which is typically, it's a rare adverse effect, but it is a possible one. And these are other things that could not lead to compliance with the parents. Vagal nerve stimulation, or VNS, is another treatment that can be used for LGS. It has been shown to help with atonic seizures, or the drop attacks that are typically associated with LGS. The VNS is a device that is surgically implanted, typically right beneath the clavicle, and it has a lead wire that is tunneled subcutaneously up the neck and to the vagus nerve, and it's wrapped around the vagus nerve on the left side. This wire will stimulate the vagus nerve with pulses of electrical stimulation that is programmed to be delivered at certain time intervals. The VNS has been shown to reduce total seizure frequency by 46 to 58%, and it can reduce atonic seizures by 88%. The last treatment for LGS, cannabidiol, is also a controversial one. Cannabidiol is a compound of marijuana. It is also known as CBD, and it can be used to treat any form of severe epilepsy that has not responded to AEDs. Cannabidiol is actually a form of marijuana that has the THC completely removed, or a very minute amount of THC in it. So the children will not have any feeling of a high from having medical marijuana in this case. I have had experience with 4 children taking CBD oil, and it was extremely effective. 3 of them had LGS, 1 of them had LGS and West syndrome, and it was very effective for all 4 children. There is one study of 150 patients aged 1 to 18, and it showed that more than 50% had a reduction in seizure activity. Unfortunately, there is very little research on the effectiveness and the use or long-term effects of cannabidiol, and we definitely need to have more randomized controlled trials on the uses of cannabidiol in the treatment of intractable epilepsy.